My name is Erin Rogers, and I'm the Executive Director of Student Services in the College of Nursing. Today, I'm going to share some information with you about our Bachelor of Science in Nursing pre-licensure option. Once enrolled at East Carolina University, our students are considered intended majors until they submit their application and are accepted to the nursing program. These students will take their prerequisite courses, which includes the university's foundation curriculum requirements as well as the cognate requirements. You can review our curriculum plan on our website and look at the courses that are listed under the freshman and sophomore year in order to review which courses are part of our curriculum. Also, your advisor can assist you with selecting courses when it's time for you to register at ECU. During the junior and senior year, once accepted into the nursing program, our students take all of their nursing courses. They take lecture courses as well as labs and attend clinical. There is a separate application process to apply to the College of Nursing. Typically, our students will apply in their sophomore year when they are in the last of the prerequisite courses. Again, you'll work with your advisor to determine when it's time for you to apply to our program. We do have a minimum GPA of a 2.75 in order to apply, and we also require that you have a grade of C or higher in the college algebra, the chemistry, and biology courses. Our deadlines are September 1st for a spring application cycle and February 1st for a fall application cycle. We accept 130 students each semester, so 260 students per year are accepted into the College of Nursing as a pre-licensure BSN student. As I said before, you have to complete all of the prerequisites prior to beginning the junior year nursing courses. Admission is competitive, and it is based on a pre-admission exam as well as the ranking formula, which I will go into detail in a few minutes. Our students do have to have a satisfactory criminal background check and drug screen in order to be accepted to practice in a clinical site. The pre-admission exam that we use is the HESI A2 exam. It includes 5 sections: basic math skills, reading comprehension, vocabulary and general knowledge, biology, anatomy, physiology, and some other K-12 level content. We do require that our students achieve a 75% or better in each of these areas to be considered in our applicant pool. Our students can take the exam twice, and they have a 3-month waiting period in between attempts if they do need to retake it again. There is a designated window for when you should take the exam, so you should work with your academic advisor in order to determine what your date range for taking the HESI A2 exam would be. The ranking formula, which can also be printed and downloaded from our website, is primarily GPA driven. The higher your cumulative GPA, the higher the points that you receive in that particular section of the ranking formula. The second part of the ranking formula is looking at students who enrolled at ECU as a freshman. They get 2 points. Our students who transfer to ECU and complete a full-time semester here get 1 point in that particular category. Then we look to see if students have had to repeat any of their chemistry, biology, or math courses that we require. Students who make a C or better will get 2 points because they will not have had any repeats. If you have 1 repeat, meaning you made a C- or below in one of those courses, then you would get 1 point. If you had to repeat 2 or more courses in that particular area, then you would not get any points for those repeats. Also, students who have an LPN license can get 1 point, veteran students get a point, and honors college students get a point. We add the points together and select the top 130 applicants that also met the 75% in the HESI A2 exam. Typically, the average GPA of students who get into the program have a 3.4 to a 3.7. It depends on the applicant pool that semester in regards to how competitive each applicant pool is. We do encourage our students to have a rank of 10 or above and have at least a 3.2 GPA in order to be a competitive applicant. If you have questions about the competitiveness of your application, you can contact your academic advisor or the Student Services Office and ask to speak with an academic advisor. Once you're admitted to the College of Nursing and are a declared nursing major taking your nursing classes, our students do travel to clinical. Clinical sites can be 1 to 1.5 hours within a radius of Greenville. Our typical distance, though, is between about 30 and 45 minutes, and often our students will carpool with one another to get to their clinical site. They only go to clinical 1 to 2 days per week until their last semester, in which they complete a capstone, which is set up a little bit differently. And they do change each semester so that you can have a variety of clinical experiences that will complement the content that you're learning in the classroom. There are some additional costs once you enter the junior and senior year and are a declared nursing major that we'd like to make you aware of. There is a health sciences fee that you will see appear on your tuition statement, as well as a nursing course fee that covers additional costs for the clinical and lab courses. You do have to purchase uniforms, and of course I mentioned the criminal background check and drug screen earlier in the presentation. You do have to have certain requirements in order to go into the clinical setting, so our students will have to obtain CPR certification and get a physical exam with certain titers and other vaccinations that have to be on file. Our liability insurance is covered by your student fees, but we do house all of this information in an electronic file. Currently we're using My Record Tracker, so there is a one-time cost for that as well. If you have questions about additional costs, you can contact me and I'll be happy to share more details regarding those costs with you individually. I know we've talked a lot about the academic rigors and competitiveness of our pre-licensure option, but we want you to know that ECU and the College of Nursing offer quite a few resources for success, and we would love for you to take advantage of those resources. We do use professional advisors. They're here to assist you with course selection and also with ECU policies and procedures. If you have any questions, you're certainly welcome to contact your academic advisor, and if you are not enrolled at ECU yet, you can contact Student Services and we will be happy to assist you. We have advisors in the office Monday through Friday, 8 a.m. to 5 p.m. Our students can also take COAD 1000 if they enroll at ECU as a freshman. This is a freshman seminar course that helps students with the transition from high school to college. And we encourage students to take this course. It does count as one of their free elective hours, and it also helps them with time management, stress management, and just learning more about the careers in nursing. We do offer our students an opportunity to apply for our nurse shadowing program, and we offer a number of workshops that our students can attend that help, again, with applying to the College of Nursing, stress management, time management, and prepping for the HESI A2 exam as well. Once you're enrolled in the College of Nursing, we also have our Student Development and Counseling Center, and our students utilize that office to assist with study skills and test reviews and things like that to help them be more successful while enrolled here in the College of Nursing. That office is staffed with 2 licensed professional counselors, and they will help our students process information that they have learned in the classroom and also experienced in the clinical setting. Additionally, the Pirate Academic Success Center is utilized tremendously by our intended nursing majors for help with chemistry, college algebra, and really any other prerequisite courses that they take. So we would encourage you to utilize that resource as well. Scholarship opportunities, there is the Forgivable Education Loan for Service, and you can go on the cfnc.org website to learn more about that. It is available for North Carolina residents who have a 3.0 GPA or higher, and you do not have to be admitted to the nursing program in order to apply for that scholarship. Most other scholarships that we offer are available for our junior and senior students, and we would send that information out once you are enrolled in a declared nursing major through your ECU email. We also offer numerous opportunities for our students to get involved. It's not just about the academic rigors and competitiveness within the College of Nursing. We want our students to take advantage of the resources that we offer and also get involved with their peers and engage in leadership opportunities that will help them once you graduate and are out there working as a nurse. We offer the Interprofessional Health Sciences Student Leadership Council for our students to participate in. We also have our Student Leadership Council that includes our class representatives, which students can become leaders within their class. That's also a very nice way to develop your leadership skills in preparation for your career in nursing. East Carolina Association of Nursing Students, which we refer to as ECANS, they also meet over on East Campus so that our intended majors have an opportunity to get involved with that organization as well. Although they can be involved in any of these organizations, they specifically will have meetings over on East Campus for our intended nursing majors a few times a semester. There's opportunities to be involved in Beta Nu if you are invited to participate in Beta Nu. You also can participate in the American Assembly for Men in Nursing, Multicultural Student Nurse Association, Holistic Health Organization, and our Nursing Christian Fellowship. I want to thank you for viewing our video, and if you have any questions, please contact us directly. We look forward to working with you.
There'd be a lot of stuff on